Question 1. What is the primary purpose of a functional behavior assessment, FBA? A. To diagnose a developmental disorder. B. To identify the function or purpose of a challenging behavior. C. To determine a client's IQ score. D. To teach new academic skills. Answer: B. To identify the function or purpose of a challenging behavior. This question is asking about the main reason we conduct a functional behavior assessment, or FBA. The term functional in FBA is a big clue. It means we are looking for the function or purpose the behavior serves for the individual. Instead of just describing a challenging behavior, an FBA helps us figure out why the person is doing it, like if they are trying to get attention, escape a task, get something tangible, or because it feels good, sensory. Understanding the why is crucial because it guides us in choosing effective strategies to replace the challenging behavior with a more appropriate one that serves the same function. For instance, if a child screams to get attention, the FBA identifies attention as the function, so we might teach them to tap your shoulder instead. Remember, FBA equals figuring out the function, the why, of the behavior. Question 2. Which of the following is an example of negative reinforcement? A. Giving a child a cookie for completing their homework, resulting in the child completing homework more often. B. Taking away a child's video game after they hit their sibling, resulting in the child hitting less often. C. A person takes an aspirin to get rid of a headache, resulting in the person taking aspirin more often when they have headaches. D. Ignoring a child's tantrum, resulting in the tantrum behavior decreasing over time. Answer: C. A person takes an aspirin to get rid of a headache, resulting in the person taking aspirin more often when they have headaches. This question tests your understanding of negative reinforcement, which sounds tricky because of the word negative, but it's still about increasing a behavior. The key here is negative reinforcement. Negative means removing or taking something away, and reinforcement means the behavior increases in the future. So, negative reinforcement happens when a behavior is followed by the removal of something unpleasant, and this removal makes the behavior more likely to happen again. In the example of taking aspirin, the behavior is taking aspirin, and the unpleasant thing being removed is the headache, because taking aspirin removes the headache and you are more likely to take aspirin next time you have a headache. This is negative reinforcement. Think of it this way. You do something, take aspirin, to make something bad go away, headache, and you'll do it again because it worked. Question 3. When measuring the duration of a behavior, what are you recording? A. The number of times the behavior occurs. B. The time from the start of a stimulus until the behavior begins. C. The total amount of time the behavior occurs from start to finish. D. The time between occurrences of the behavior. Answer: C. The total amount of time the behavior occurs from start to finish. This question is about one way we measure behavior: duration. The term duration itself is a big clue. It means how long something lasts. In ABA, when we measure the duration of a behavior, we're specifically tracking the total amount of time that passes from the moment the behavior starts until the moment it stops. For example, if a child has a tantrum, measuring duration would mean starting a timer when the tantrum begins and stopping it when it ends. This measure is useful for behaviors that happen continuously for a period of time, like staying on task, crying, or engaging in a repetitive behavior. Remember, duration is all about how long the behavior occurs. Question 4. A motivating operation, MO, is something that changes the value of a reinforcer and the likelihood of behaviors that have been reinforced by that reinforcer. Which of the following is an example of an abolishing operation, AO? A. A child hasn't had access to toys all day, making toys very valuable and increasing the likelihood of asking for toys. B. A person is very thirsty, making water very valuable and increasing the likelihood of asking for water. C. A child just ate a large meal, making food less valuable and decreasing the likelihood of asking for food. D. A student is tired of sitting and wants to take a break, making escape from the task very valuable. Answer C. A child just ate a large meal, making food less valuable and decreasing the likelihood of asking for food. This question is about motivating operations, MOs, which are things that make us want or not want something, influencing our behavior. Specifically, it asks about an abolishing operation, AO. And MMO changes how much we want something, the value of a reinforcer, and how likely we are to do things to get it. An abolishing operation, AO, decreases the value of a reinforcer and decreases the likelihood of behaviors that get that reinforcer. Think of it like this. If you just ate a big meal, the AO, food, the reinforcer, becomes much less appealing, and you're much less likely to ask for food, the behavior. The AO abolishes or reduces the effectiveness of something as a reinforcer. Here's a simple way. If you're full, food isn't reinforcing, and that fullness is an AO. Question 5. A behavior intervention plan, BIP, should be based on the results of what? A. A medical evaluation. B. A standardized IQ test. C. A functional behavior assessment, FBA. D. An academic achievement test. Answer C. A functional behavior assessment, FBA. This question focuses on where a behavior intervention plan, BIP, gets its foundation. The best and most effective behavior plans aren't just guesses. They are carefully built upon understanding why the behavior is happening in the first place. As we discussed earlier, that why is figured out through a functional behavior assessment, FBA. The FBA tells us the function, like getting attention or escaping a task, of the challenging behavior. Once we know the function, the BIP is developed to teach a replacement behavior that serves the same function in a more appropriate way and to change the environment so the challenging behavior is less likely to occur and less effective when it does. Think of the FBA as the diagnosis and the BIP as the treatment plan. You need the diagnosis first to make a good plan. Question 6. When a previously reinforced behavior is no longer followed by reinforcement and its frequency decreases over time, this is called A. Punishment. B. Extinction. C. Negative reinforcement. D. Response cost. Answer B. Extinction. This question is about extinction, which is a procedure used to decrease behavior. The key idea is that a behavior that used to get reinforced suddenly stops getting that reinforcement. When the thing that was maintaining the behavior is no longer provided, the behavior gradually decreases and might eventually stop altogether. For example, if a child used to whine to get a cookie, and it worked, but now you stop giving them a cookie when they whine, the whining behavior is on extinction and should decrease over time. It's important to note that extinction doesn't involve adding something or removing something after the behavior to decrease it, like punishment. It's about withholding the reinforcement that was already maintaining the behavior. Think of it as starving the behavior, taking away its food source, the reinforcement. Question 7. Which type of data collection involves observing whether a behavior occurs at any point during a specific interval? A. Frequency recording. B. Duration recording. C. Partial interval recording. D. Momentary time sampling. Answer C. Partial interval recording. This question describes a specific type of discontinuous measurement called partial interval recording. In this method, you divide your observation time into small intervals, like 10 seconds. You then watch the client during each interval. If the target behavior happens at any point during that interval, even for just a moment, you mark that interval as a plus or a score of 1. It doesn't matter how many times it occurs or how long it lasts within that interval. You just need to see it happen at least once. This method is often used for behaviors you want to decrease that might occur often or continuously. For example, if you're tracking hand flapping during a 10-minute period divided into 1-minute intervals, you'd mark an interval if hand flapping happened at any time during that minute. A simple way to remember partial interval is that the behavior only needs to occur during part of the interval to be recorded. Question 8. What is shaping? A. Teaching a skill by breaking it down into smaller steps. B. Providing reinforcement only when a behavior does not occur. C. Differentially reinforcing successive approximations toward a target behavior. D. Allowing a client to choose their own activities. Answer: C. Differentially reinforcing successive approximations toward a target behavior. This question asks about shaping, which is a teaching procedure used to teach new behaviors. The core idea of shaping is that you don't wait for the perfect final behavior to happen. Instead, you start by reinforcing any behavior that is even a little bit like the target behavior, an approximation. Once the client is doing that consistently, you stop reinforcing that simpler behavior and only reinforce behaviors that are closer to the final goal, a successive approximation. You gradually raise the requirement for reinforcement step by step until the client is performing the desired target behavior. For example, to teach a child to say water, you might first reinforce any sound like wah, then wah, and finally water. You are shaping the behavior little by little. Question 9. A stimulus that signals that reinforcement is available for a particular behavior is called A. Conditioned punisher. B. Motivating operation, MO. C. Stimulus generalization. D. Discriminative stimulus, SD. Answer: D. Discriminative stimulus, SD. This question is about understanding discriminative stimuli, or SDs. An SD is like a go signal for a specific behavior because, in the past, that behavior has been reinforced in the presence of that stimulus. It tells you that if you perform a certain behavior now, you are likely to get reinforcement. Think of a stop sign, and SD for stopping. When you see the stop sign, the stimulus, stopping the car, the behavior, is reinforced. You avoid an accident or ticket. Another example is the sound of a bell, an SD. Signaling that class is over, getting up and leaving, the behavior is reinforced. You get to leave. This helps you discriminate when to do a behavior to get a good outcome. Question 10. Which ethical principle in the BCBA code emphasizes working only within your area of training and experience? A. Beneficence and non-maleficence. Do good, do no harm. B. Responsibility. Be trustworthy. C. Integrity. Be truthful. D. Competence. Practice within your limits. Answer: D. Competence. Practice within your limits. This question is about a key ethical principle for behavior analysts: competence. The principle of competence means that you should only provide services, teach, or conduct research in areas where you have the necessary education, training, supervised experience, and credentials. It's about recognizing the boundaries of your expertise and not working outside of them. For example, a BCBA who primarily works with young children with autism shouldn't start providing services for adults with traumatic brain injury without getting additional specific training and supervision in that area. Upholding competence ensures you are providing the best possible service and not potentially harming clients by working in areas you aren't qualified for. Question 11. When a client performs a behavior slower or less often than desired, you might want to increase the behaviors. A. Latency. B. Interresponse time, IRT. C. Duration. D. Magnitude. Answer: B. Interresponse time, IRT. This question asks about a specific dimension of behavior related to its timing. Interresponse time, IRT. IRT is the time that passes between two consecutive occurrences of the same behavior. If a behavior is happening too slowly or not often enough, it means the time between each instance is too long. By decreasing the IRT, making the time between behaviors shorter, you increase the rate or frequency of the behavior. For example, if you want a student to answer math problems faster, you are trying to decrease the hierarchy between finishing one problem and starting the next. If you want a child to take more bites of food during a meal, you are trying to decrease the hierarchy between bites. Shortening the gap, IRT, makes the behavior happen more frequently. Question 12. In behavior analysis, punishment is defined by its effect on behavior. Punishment occurs when a stimulus change immediately following a behavior results in A. An increase in the future frequency of that behavior. B. A decrease in the future frequency of that behavior. C. No change in the future frequency of that behavior. D. A decrease in the intensity of that behavior. Answer: B. A decrease in the future frequency of that behavior. This question is testing the definition of punishment in ABA, which is strictly defined by its effect on behavior, specifically that the behavior decreases. It doesn't matter if you intended to punish or if the consequence seems unpleasant to you. If the behavior doesn't decrease in the future, it wasn't punishment according to the ABA definition. Punishment involves a consequence, adding or removing a stimulus, that immediately follows a behavior and makes that behavior less likely to occur again in similar situations. For example, if a child touches a hot stove, behavior, and feels pain, stimulus added, and is then less likely to touch the stove again, that's punishment. The key is the decrease in the behavior's future occurrence. Question 13. What is a prompt? A. A consequence delivered after a behavior. B. A stimulus or cue added before or during a behavior to help ensure it occurs correctly. C. A procedure to decrease unwanted behavior. D. The natural consequence of a behavior. Answer: B. A stimulus or cue added before or during a behavior to help ensure it occurs correctly. This question is about prompts, which are widely used tools in teaching new skills. A prompt is something you add to the situation before or while the client is performing a behavior to make it more likely they will do it correctly. Prompts are essentially temporary helpers or cues. Examples include physically guiding someone to do a movement, physical prompt, showing them what to do, model prompt, giving a verbal instruction, verbal prompt, or pointing to the correct answer, gestural prompt. Prompts are designed to help the learner succeed, and the goal is always to eventually remove them, fade them out, so the learner can perform the behavior independently when the natural signal, SD, is present. Question 14. Which type of preference assessment involves presenting two items at a time and recording which one the client chooses? A. Multiple stimulus without replacement, MSDO. B. Free operant. C. Paired stimulus, forced choice. D. Single stimulus, successive choice. Answer: C. Paired stimulus, forced choice. This question asks about a specific method for figuring out what a client likes, known as a preference assessment. The description perfectly matches the paired stimulus assessment, also often called forced choice. In this method, you literally present just two items or activities to the client at the same time and ask them to choose one. You record which one they select. You then repeat this process with every possible pair of items from your list. By seeing which items are chosen more often when paired with others, you can create a hierarchy of preferences. It's called forced choice because the client is forced to choose between the two presented options. Question 15. When supervising a behavior technician, a BCBA should A. Primarily focus on administrative tasks. B. Provide ongoing feedback, training, and evaluation of their performance. C. Only interact with them during formal review meetings. D. Assign tasks without explaining the rationale. Answer: B. Provide ongoing feedback, training, and evaluation of their performance. This question touches on the important ethical and practical responsibility of supervision in ABA. Supervising a behavior technician, like an RBT, is not just about assigning work. It's a dynamic process aimed at ensuring the technician is providing high-quality ethical services and developing their skills. This involves regular meetings, observing their work with clients, providing constructive feedback, both positive and corrective, training them on specific procedures, and formally evaluating their performance. Effective supervision is crucial for client progress and technician growth. Think of supervision as ongoing coaching and support to make sure everyone is doing their best for the client. Question 16. An operational definition of a behavior should be: A. Vague and open to interpretation. B. Subjective and based on feelings. C. Clear, objective, and measurable. D. Focused on the client's intent or motivation. Answer: C. Clear, objective, and measurable. This question is about the importance of defining behaviors clearly in ABA. An operational definition is like a recipe for the behavior. It tells anyone exactly what to look for so they can reliably identify and measure it. A good operational definition must be objective, describing only what is observable, not feelings or interpretations. Clear, easy for anyone to understand, and measurable, allowing you to count, time, or otherwise quantify the behavior. For example, instead of saying the child was aggressive, an operational definition might be any instance of hitting with an open hand or closed fist that makes contact with another person's body. This ensures everyone collecting data knows exactly what counts as an instance of the behavior. A clear definition is key to consistent data. Question 17. Stimulus generalization occurs when: A. A behavior is performed in the presence of stimuli that are similar to the original discriminative stimulus. B. A response that was reinforced in one situation occurs in a completely different situation. C. A behavior decreases because it is no longer reinforced. D. Two different behaviors occur in the presence of the same stimulus. Answer: A. A behavior is performed in the presence of stimuli that are similar to the original discriminative stimulus. This question is about stimulus generalization, which is when a learned behavior happens not just in the exact situation or with the exact object it was taught with, but also in similar situations or with similar objects. It's about the behavior spreading to other stimuli that share features with the original one. For example, if a child learns to say dog when they see their pet golden retriever, the original SD. Stimulus generalization is when they also say dog when they see a picture of a different breed of dog or a real dog that looks different. This is often a good thing, as it means skills learned in one setting can be used in others. It shows the behavior is under the control of a class of stimuli, not just one specific one. Question 18. Differential reinforcement is a procedure that involves: A. Reinforcing a behavior every single time it occurs. B. Punishing a behavior every single time it occurs. C. Reinforcing one behavior while withholding reinforcement for another behavior. D. Reinforcing a behavior only when a specific amount of time has passed. Answer: C. Reinforcing one behavior while withholding reinforcement for another behavior. This question describes differential reinforcement, a core strategy used to teach new behaviors or decrease unwanted ones. It involves two key parts happening at the same time. You reinforce the desired behavior or the absence of an unwanted behavior, and you do not reinforce, put on extinction, the unwanted behavior or any other behavior. Essentially, you are teaching the learner to discriminate. This behavior gets good things, that behavior does not. There are different types, like DRO. Reinforcing the absence of a behavior, or DRI/DRA. Reinforcing a different, incompatible, or alternative behavior. The core idea is reinforcing the good stuff, while ignoring or not reinforcing the challenging stuff. Question 19. What does BIP stand for? A. Behavior Improvement Plan. B. Behavior Intervention Protocol. C. Behavior Intervention Plan. D. Basic Interaction Procedure. Answer: C. Behavior Intervention Plan. This is a straightforward question asking for the common acronym BIP. In the field of ABA, BIP stands for Behavior Intervention Plan. As we discussed earlier, this is the detailed plan that is developed based on the findings of a functional behavior assessment, FBA, to address challenging behaviors. It outlines strategies to prevent the behavior from happening, what to do when it does happen, and how to teach replacement behaviors. Knowing the acronyms is part of understanding the language of the field. Question 20. The gradual removal of prompts as the learner becomes more independent is called A. Shaping, B. Chaining, C. Fading, D. Generalization. Answer: C. Fading. This question is about fading, which is a critical step when using prompts to teach new skills. Remember that prompts are temporary helpers. Once a learner starts to perform the behavior more reliably with a prompt, you want to start removing that prompt little by little. This gradual removal is called fading. The goal of fading is to transfer control of the behavior from the prompt to the natural discriminative stimulus, SD, so the learner can perform the skill independently. For example, if you used physical guidance to help someone write their name, fading would involve gradually lessening the amount of physical help until they can write it on their own just by looking at the paper and pen. You are fading out your help. Question 21. When graphing data, the x-axis, horizontal axis, typically represents A. The behavior being measured, B. The measurement unit example frequency, duration, C. Time example sessions, days, dates, D. The value of the behavior measurement. Answer: C. Time example sessions, days, dates. This question relates to how we visually represent data in ABA, usually on a line graph. Graphs help us see patterns and changes in behavior over time. On a standard line graph used in ABA, the horizontal line, called the x-axis, always represents time. This could be specific dates, session numbers, days of the week, or any unit that shows the progression of time during which the behavior was measured. The vertical line, the y-axis, represents the measure of the behavior, like frequency, duration, percentage, etc. So, remember, x marks the spot on the timeline. Question 22. The ethical principle of beneficence and non-maleficence means A. Being truthful and honest in all professional interactions. B. Acting in the best interests of the client and avoiding harm. C. Respecting the privacy and confidentiality of clients. D. Only providing services within your area of expertise. Answer: B. Acting in the best interests of the client and avoiding harm. This question asks about the fundamental ethical principle of beneficence and non-maleficence. This principle is often summarized as do good, do no harm. It means that behavior analysts should always prioritize the well-being and best interests of their clients. This involves evaluating potential risks and benefits of any intervention or procedure and choosing those that are most likely to help the client while minimizing any potential harm. It's the core idea that our interventions should be helpful and safe. Question 23. Which of the following is an example of stimulus control? A. A child cries whenever they are hungry. B. A dog salivates at the sound of a bell because it was previously paired with food. C. A student answers blue when shown a blue card, but not when shown a red card. D. A person feels anxious when thinking about public speaking. Answer: C. A student answers blue when shown a blue card, but not when shown a red card. This question is about stimulus control, which happens when a behavior is more likely to occur in the presence of a specific stimulus or set of stimuli than in its absence or in the presence of different stimuli. The behavior has come under the control of that particular stimulus because it has been reinforced in the past only when that stimulus was present. In the example, the student's behavior of saying blue is under the stimulus control of the blue card. The blue card is the discriminative stimulus, SD, for saying blue, and the red card is an S delta, SD, signaling that saying blue will not be reinforced. The The student discriminates between the two colors. Question 24. What is the definition of a behavior chain? A. A single response that is reinforced. B. A sequence of responses linked together, where each response produces the stimulus that serves as the discriminative stimulus for the next response. C. A behavior that occurs more frequently in the presence of a specific stimulus. D. A behavior that decreases in frequency due to the removal of reinforcement. Answer: B. A sequence of responses linked together, where each response produces the stimulus that serves as the discriminative stimulus for the next response. This question describes a behavior chain, which is a way to teach complex skills by breaking them down into smaller, manageable steps performed in a specific order. Think of tasks like washing your hands, brushing your teeth, or getting dressed. Each step in the chain becomes the signal, SD, to perform the next step. For example, turning on the water. Step 1 produces the sound of running water, which is the est for putting soap on your hands. Step 2, which produces lather, the est for rinsing. Step 3, and so on. Reinforcement is typically delivered after the last step in the chain is completed. We teach chains using procedures like forward chaining, backward chaining, or total task presentation. Question 25. Which type of punishment involves the removal of a stimulus following a behavior, resulting in a decrease in the future frequency of that behavior? A. Positive punishment. B. Negative punishment. C. Positive reinforcement. D. Negative reinforcement. Answer: B. Negative punishment. This question is about negative punishment. Remember the definition of punishment. The behavior decreases. The word negative here means removing something. So, negative punishment is when a behavior is followed immediately by the removal of a stimulus, something is taken away. And as a result, the behavior is less likely to happen in the future. A common example is taking away a toy, removing a stimulus from a child who is fighting over it, which results in the child being less likely to fight in the future. Something good or desired is taken away to make the behavior decrease. Question 26. When preparing to take data on a target behavior, the first step should always be to A. Choose a graphing method. B. Select a reinforcement schedule. C. Develop an operational definition for the behavior. D. Decide on a punishment procedure. Answer: C. Develop an operational definition for the behavior. This question highlights a crucial first step in data collection. Before you can accurately measure a behavior, you need to know exactly what behavior you are looking for. That's why the very first step is creating a clear, objective, and measurable operational definition. Without a solid definition, different people might measure different things, leading to inconsistent and unreliable data. You need to define aggression, on task, or communication in a way that leaves no room for guesswork before you can start counting or timing it. Get the definition right first. Question 27. A schedule of reinforcement where the first response after a fixed amount of time has passed is reinforced is called A. Fixed ratio, FR. B. Variable ratio, VR. C. Fixed interval, FI. D. Variable interval, VI. Answer: C. Fixed interval, FI. This question asks about one of the basic intermittent schedules of reinforcement. Fixed interval, FI. In an FI schedule, reinforcement becomes available after a specific set amount of time has passed, but the learner must perform the target behavior at least once after that time is up to get the reinforcement. The time interval is fixed, meaning it's always the same. An example is getting paid every 2 weeks. FI 2 weeks. You have to work behavior during that 2-week period, but you only get paid after the 2 weeks are up, and you have to be employed. Perform the behavior at the time of payment. FI schedules often produce a pattern where the learner pauses after reinforcement, and then gradually increases responding as the interval is about to end. Question 28. Which type of continuous measurement involves counting every instance of a behavior? A. Frequency. B. Duration. C. Latency. D. Interval recording. Answer: A. Frequency. This question describes frequency recording, also known as event recording. Frequency is a basic continuous measurement method where you simply count how many times the specific behavior occurs within an observation period. If the behavior happens, you make a tally mark or click a counter. This method is best for behaviors that have a clear beginning and end and don't happen constantly for long periods. For example, counting how many times a student raises their hand or how many times a child bites their fingernails. It's a simple count of events. Question 29. In a skills assessment like the VB-MAPP or ABLSR, what is being assessed? A. The function of challenging behaviors. B. A client's preferences for reinforcers. C. A client's current abilities across various developmental domains. D. The frequency of a target behavior. Answer: C. A client's current abilities across various developmental domains. This question is about skills assessments, which are different from functional behavior assessments or preference assessments. Tools like the VB-MAPP and ABLSR are designed to evaluate what a client can do across a wide range of skills, such as language, social skills, daily living skills, motor skills, and academic readiness. They help identify a client's strengths and areas where they need to learn new skills. The results of a skills assessment inform the development of teaching goals and objectives, not behavior reduction plans or reinforcer lists. Question 30. If a client quickly performs a behavior after a direction is given, their latency is A. High. B. Low. C. Variable. D. Immeasurable. Answer: B. Low. This question is about latency, another dimension of behavior related to timing. Latency is the time from when a stimulus, like a direction or cue, is presented until the behavior begins. If a client performs the behavior quickly after the direction, it means the time between the direction and the start of the behavior is short. Therefore, their latency is low. If they take a long time to start the behavior, their latency would be high. Think of latency as the lag time between the signal and the action. Question 31. Generalization of a skill is most likely to occur when A. The skill is taught in only one specific environment. B. Reinforcement is delivered on a continuous schedule. C. The skill is taught using a variety of examples and in multiple settings. D. Prompts are never used during teaching. Answer: C. The skill is taught using a variety of examples and in multiple settings. This question is about promoting generalization, which is when a learned skill or behavior occurs in new, untrained situations, with different people or using different materials. We want skills learned in therapy to be used in the real world. The best way to encourage generalization is to plan for it from the beginning. This means teaching the skill using a variety of examples, different types of balls if teaching ball, practicing the skill in different places, therapy room, classroom, home, and with different people. By varying the teaching conditions, the learner is more likely to perform the skill when encountering similar, but not identical, situations in the future. Question 32. An unconditioned reinforcer is something that is reinforcing. A. Because it has been paired with other reinforcers. B. Naturally, without any prior learning history. C. Only after a specific motivating operation is in effect. D. Only when delivered immediately after the behavior. Answer: B. Naturally, without any prior learning history. This question is about unconditioned reinforcers, also sometimes called primary reinforcers. These are things that are naturally reinforcing to most people because they are biologically important and don't require any prior learning to be reinforcing. They meet basic biological needs. Examples include food, water, sleep, and warmth. You don't have to teach someone that water is good when they are thirsty. It's automatically reinforcing because it satisfies a biological need. Conditioned reinforcers, on the other hand, are things that become reinforcing through learning by being paired with unconditioned reinforcers or other conditioned reinforcers, like money or praise. Question 33. When implementing an extinction procedure, you might initially see an increase in the frequency, intensity, or variability of the behavior, sometimes accompanied by aggression. This is known as A. Spontaneous recovery, B. Stimulus generalization, C. An extinction burst, D. Punishment. Answer: C. An extinction burst. This question describes a common phenomenon that can happen when you first start using an extinction procedure, an extinction burst. It's like the behavior is making one last attempt to get the reinforcement that used to follow it. The behavior might get temporarily worse, stronger, or show variations you haven't seen before, and sometimes the person might show frustration or aggression. It's a sign that the extinction procedure is working by disrupting the old reinforcement pattern, but it can be challenging to get through. Knowing about extinction bursts helps you anticipate this temporary increase and stick with the plan. Question 34. When writing a session note, you should A. Write subjective opinions about the client's mood. B. Focus on observed behaviors and objective data. C. Only document challenging behaviors. D. Use jargon and technical terms without explanation. Answer: B. Focus on observed behaviors and objective data. This question is about best practices for writing session notes, which are important clinical documents. Good session notes in ABA should be objective and based on observable events. This means describing what the client did and what you did, reporting data accurately, and avoiding subjective interpretations or opinions about why the client behaved a certain way or what they were feeling. Stick to the facts, the behaviors you targeted, the data collected, and any significant events that occurred. This ensures the notes are accurate, reliable, and useful for tracking progress and communicating with the BCBA. Question 35. Teaching a client to wash their hands by breaking the skill down into small steps and teaching the last step first is an example of A. Forward chaining, B. Backward chaining, C. Total task chaining, D. Shaping. Answer: B. Backward chaining. This question describes backward chaining, which is a method for teaching a behavior chain, a sequence of steps. In backward chaining, you identify all the steps in the chain, but you teach them in reverse order. You prompt the client through all steps except the very last one, which you teach first. Once the client can do the last step independently, you teach the second to last step, prompting through the rest, and so on, until the client can do the first step. Reinforcement is always delivered when the final step of the chain is completed independently. This method allows the learner to experience the natural reinforcer, completing the task relatively quickly. For hand washing, you might teach drying hands first, then rinsing and drying, then washing, rinsing, and drying, etc. Question 36. When conducting a functional analysis, FA, the goal is to A. Describe the behavior in measurable terms. B. Observe the behavior in naturalistic settings. C. Systematically manipulate antecedents and consequences to determine the function of a behavior. D. Interview caregivers about the behavior. Answer: C. Systematically manipulate antecedents and consequences to determine the function of a behavior. This question is specifically about a functional analysis, FA, which is a type of FBA considered the most rigorous because it involves actually testing hypotheses about behavior function by systematically arranging different conditions. In an FA, the behavior analyst creates situations where a specific consequence, like attention, escape, or access to tangibles, is consistently provided after the challenging behavior or conditions where the behavior is ignored or prevented. By seeing which condition leads to the highest rate of the behavior, they can determine its function. It's an experiment to find the why of the behavior. Question 37. Which graph is most commonly used in ABA to display data over time? A. Bar graph, B. Pie chart, C. Scatter plot, D. Line graph. Answer: D. Line graph. This question asks about the standard type of graph used in ABA. While other graphs exist, a line graph is the most common and useful tool for displaying behavioral data because it clearly shows how a behavior changes over time. The x-axis shows time, sessions, days. The y-axis shows the behavior measurement, frequency, duration, etc. And the line connects the data points across time, making it easy to see trends, like whether a behavior is increasing, decreasing, or staying stable. This visual representation is essential for making database decisions about intervention effectiveness. Question 38. An environment where reinforcement is available for a specific behavior is called A. S delta, SD. B. Unconditioned stimulus. C. Discriminative stimulus, SD. D. Conditioned response. Answer: C. Discriminative stimulus, SD. This question revisits the concept of a discriminative stimulus, SD. And ST is a signal that tells the learner that reinforcement is currently available if they perform a specific behavior. It sets the occasion for the behavior because doing the behavior in the presence of the ST has led to reinforcement in the past. Think of a traffic light turning green, the SD. This signals that driving forward, the behavior will be reinforced. You get to your destination and not punished. You don't get hit by another car or get a ticket. It's the signal that says, now is the time to do this to get the good stuff. Question 39. Providing reinforcement after an average number of responses has occurred is an example of which schedule of reinforcement? A. Fixed ratio, FR. B. Variable ratio, VR. C. Fixed interval, FI. D. Variable interval, VI. Answer: B. Variable ratio, VR. This question describes the variable ratio, VR, schedule of reinforcement. In a VR schedule, reinforcement is delivered after a certain number of responses, but that number varies from one reinforcement delivery to the next, though it averages out to a specific number. For example, a slot machine is a VR schedule. You have to pull the lever, the behavior, multiple times to win, get reinforcement. But you never know exactly how many pulls it will take. It's a variable number each time. VR schedules are known for producing high, steady rates of responding because the learner never knows which response will be the reinforced one. Question 40. Which ethical principle involves protecting client information and discussing it only with authorized individuals? A. Competence. B. Integrity. C. Responsibility. D. Confidentiality. Answer: D. Confidentiality. This question is about the critical ethical principle of confidentiality. This means keeping private information about your clients secure and not sharing it with anyone who doesn't have a legitimate need to know, based on legal, professional, or clinical reasons. This includes things like their name, diagnosis, treatment details, progress, etc. Protecting confidentiality builds trust with clients and their families, and is a fundamental part of ethical practice. You always need permission or a legal requirement to share client information. Question 41. What is the primary goal of a skill acquisition plan? A. To decrease challenging behaviors. B. To identify the function of a behavior. C. To teach new skills and behaviors. D. To determine a client's preferences. Answer: C. To teach new skills and behaviors. This question asks about the main purpose of a skill acquisition plan. Unlike a BIP, which focuses on decreasing challenging behaviors based on function, a skill acquisition plan focuses on building new appropriate skills based on the results of skills assessments, like the VB-MAPP or ABLSR. The BCBA develops plans to teach specific goals, such as communication, social interaction, daily living skills, or academic readiness. These plans detail the teaching procedures, prompts, reinforcement strategies, and data collection methods needed to help the client learn the new skill. Question 42. Differential reinforcement of other behavior, DRO, involves A. Reinforcing a behavior that is incompatible with the target behavior. B. Reinforcing an alternative behavior to the target behavior. C. Reinforcing the absence of the target behavior for a specified amount of time. D. Reinforcing a low rate of the target behavior. Answer: C. Reinforcing the absence of the target behavior for a specified amount of time. This question describes the differential reinforcement of other behavior, DRO. In a DRO procedure, reinforcement is delivered if the target challenging behavior does not occur for a specific period of time. If the challenging behavior happens during the interval is reset and the reinforcement is withheld. You are essentially reinforcing any other behavior or the absence of the unwanted behavior as long as the target behavior stays away. For example, if a child bites their hand, target behavior, you might set a timer for 5 minutes. If they go 5 minutes without biting, they get a reward. If they bite at minute 3, you reset the timer. You're reinforcing not biting for that time. Question 43. The time from the end of one response until the beginning of the next identical response is called A. Latency. B. Duration. C. Interresponse time, IRT. D. Frequency. Answer: C. Interresponse time, IRT. This question circles back to interresponse time, IRT. Remember that IRT is the time between two occurrences of the same behavior. It starts when one instance of the behavior ends and stops when the very next instance of that same behavior begins. If you want a behavior to happen more often, you work to decrease the IRT. If you want it to happen less often, you increase the IRT. It's the gap between the responses. Question 44. Which of the following is an example of a tangible reinforcer? A. Praise. Good job. B. A favorite toy. C. A hug. D. A break from work. Answer: B. A favorite toy. This question asks about a type of reinforcer, a tangible reinforcer. Tangible reinforcers are physical objects that a client can touch and keep, at least temporarily. Examples include toys, snacks, stickers, books, or other items the client finds desirable. They are different from social reinforcers like praise or hugs, edible reinforcers, food, or activity reinforcers like playing a game or getting a break. A favorite toy is a clear example of something physical and desirable given after a behavior to increase its future likelihood. Question 45. The definition of behavior in ABA is A. What a person feels or thinks. B. Anything a person says or does that is observable and measurable. C. A diagnosis or label given to a person. D. The underlying cause of a person's actions. Answer: B. Anything a person says or does that is observable and measurable. This question gets to the absolute core of ABA. What do we mean by behavior? In ABA, behavior is defined very specifically. It's anything an organism does that can be observed by someone else, or even themselves, and can be measured. This includes actions, movements, vocalizations, and even physiological responses if they can be measured, like heart rate. What someone is thinking or feeling is not considered behavior in this definition because it's not directly observable by others. We focus on the doing, not the thinking or feeling, because we can see and measure the doing. Question 46. A graph that shows the relationship between two variables and is often used in functional analyses is A. Line graph. B. Bar graph. C. Scatter plot. D. Cumulative record. Answer: B. Bar graph. While line graphs are standard for showing data over time, bar graphs are often used in ABA, particularly when comparing different conditions or summarizing data across phases, like in a functional analysis. In an FA, you compare the rate of a behavior across different test conditions, example attention, escape, tangible, play. A bar graph is excellent for showing these comparisons. Each bar can represent the average rate of the behavior in a specific condition, making it easy to visually compare which condition resulted in the highest rate. It's great for showing distinct comparisons, not trends over continuous time. Question 47. When teaching a new skill, providing reinforcement for every correct response is what type of reinforcement schedule? A. Intermittent. B. Variable. C. Continuous. D. Extinction. Answer: C. Continuous. This question asks about continuous reinforcement, CRF. A continuous reinforcement schedule means that every single time the target behavior occurs correctly, it is followed immediately by reinforcement. This schedule is typically used when teaching a new skill because it helps the learner quickly make the connection between performing the behavior and receiving reinforcement. Once the skill is learned, we usually switch to an intermittent schedule to make the behavior more resistant to extinction, more likely to continue even if reinforcement isn't given every time, but for learning, CRF is key. Question 48. What is the main purpose of collecting data on a client's behavior? A. To justify billing hours. B. To prove that the client is improving. C. To make objective, data-based decisions about interventions. D. To compare the client to other clients. Answer: C. To make objective, data-based decisions about interventions. This question emphasizes the fundamental importance of data in ABA. We don't just collect data for the sake of it. We do it to understand if our interventions are working and to guide our decisions. Data provides objective evidence about whether a behavior is increasing, decreasing, or staying the same. This allows the BCBA to make informed, data-based decisions about whether to continue, modify, or change an intervention. If the data shows the behavior isn't changing as expected, it signals that the plan needs adjustment. Data keeps us accountable and guides effective treatment. Question 49. A condition where a stimulus is present, but the behavior is not reinforced in its presence is called: A. Discriminative stimulus, SD. B. S delta, SD. C. Motivating operation, MO. D. Unconditioned stimulus. Answer: B. S delta, SD. This question describes an S delta, SD, which is the opposite of a discriminative stimulus, SD. While an SD signals that reinforcement is available for a behavior, an SD signals that reinforcement is not available for that behavior, or that the behavior will be punished in that specific situation. The learner learns to not perform the behavior in the presence of the SD. For example, if raising your hand in class, behavior, gets you called on by the teacher, reinforcement, but raising your hand during the middle of a movie, behavior, does not get reinforced and might even get you shushed, punishment, then the classroom is an SD for raising your hand, and the movie theater is an SD. Question 50. When a supervisor provides feedback to a technician, it should ideally be: A. Vague and infrequent. B. Specific, timely, and actionable. C. Focused only on errors. D. Delivered only through email. Answer: B. Specific, timely, and actionable. This question relates to effective supervision practices. For feedback to be helpful, it needs to be clear and easy for the technician to understand and use. Specific means pointing to exact behaviors or instances, not vague generalities. Timely means providing feedback soon after the observation, while it's fresh in everyone's mind. Actionable means providing clear suggestions on what the technician can do differently or continue doing well. Good feedback includes both positive reinforcement for things done correctly and constructive suggestions for areas needing improvement. Question 51. A schedule of reinforcement where the first response after a variable amount of time has passed is reinforced is called A. Fixed ratio, FR. B. Variable ratio, VR. C. Fixed interval, FI. D. Variable interval, VI. Answer D. Variable interval, VI. This question describes the variable interval, VI, schedule of reinforcement. In a VI schedule, reinforcement becomes available after an amount of time that varies from one instance to the next, averaging out to a specific duration. Like the FI schedule, the behavior must occur at least once after the interval has passed to get the reinforcement. An example is checking your email for a reply. You never know exactly when the reply will arrive, variable time, but you have to check your email, the behavior, to get the reinforcement, the reply. VI schedules tend to produce steady rates of responding because the learner can't predict exactly when reinforcement will be available. Question 52. Which term refers to an increase in the responsiveness to a stimulus after repeated exposure to it? A. Habituation. B. Sensitization. C. Adaptation. D. Extinction. Answer B. Sensitization. This question touches on a simple concept related to how we react to stimuli. Sensitization is when you become more responsive or sensitive to a stimulus after experiencing it repeatedly. It's the opposite of habituation, where you become less responsive. Think of a fire alarm. The first time it goes off, you might be startled. Sensitization. If it goes off repeatedly due to a malfunction, you might eventually start ignoring it. Habituation. Sensitization means your reaction grows stronger with repeated exposure. Question 53. When creating a task analysis for a complex skill, what is the purpose of breaking the skill into smaller steps? A. To make the skill seem harder. B. To identify the function of challenging behaviors that might occur during the skill. C. To make the skill easier to teach and measure progress. D. To determine if the client has the prerequisite skills. Answer C. To make the skill easier to teach and measure progress. This question is about the purpose of a task analysis, which is essential for teaching skills using chaining procedures. A task analysis involves breaking down a complex skill, like brushing teeth or making a sandwich, into a sequence of smaller individual steps. Doing this makes the overall skill less overwhelming to the learner and easier for the teacher to manage. Each small step can be taught systematically, and progress can be measured on individual steps, providing clear data on where the learner needs more help and where they are succeeding. It's about making something big into bite-sized, teachable pieces. Question 54. When reviewing data on a graph, you notice the data points are staying relatively flat, showing little change over several sessions. This suggests A. The intervention is likely highly effective. B. The behavior is in an extinction burst. C. The intervention may not be having the desired effect and needs to be adjusted. D. The data collection method is likely flawed. Answer C. The intervention may not be having the desired effect and needs to be adjusted. This question asks you to interpret data presented on a graph. If you see the data line is flat, it means the rate, duration, or whatever measure you are tracking isn't changing significantly over time. If you're trying to increase a skill or decrease a challenging behavior, a flat line means the intervention is not currently achieving that goal. This visual cue from the graph tells the BCBA that it's time to re-evaluate the plan, maybe adjust the teaching procedure, modify the prompts, change the reinforcer, or revisit the function of the behavior. Data guides adjustments. Question 55. An example of a natural reinforcer for saying hello when someone greets you is A. Getting a sticker. B. Access to a favorite toy. C. The other person saying hello back. D. Taking a break from a task. Answer C. The other person saying hello back. This question is about natural reinforcers. Natural reinforcers are consequences that are part of the everyday environment and are not specifically programmed or delivered by a teacher or therapist. They are the typical outcomes of performing a behavior in the real world. When you say hello to someone, the natural consequence and reinforcer is typically that they say hello back, maybe smile, or engage in further conversation. This natural social interaction is what maintains the behavior of saying hello in typical situations, not getting a sticker or a toy specifically for it. Question 56. Which ethical principle emphasizes promoting the client's independence and self-sufficiency? A. Integrity. B. Responsibility. C. Autonomy. D. Beneficence. Answer: C. Autonomy. This question relates to the ethical principle of autonomy, which is about respecting the client's right to make their own choices and decisions to the greatest extent possible. In ABA, this means involving clients and their caregivers in goal setting, obtaining assent, agreement, or consent for procedures, and teaching skills that help them become more independent and self-advocate. We aim to increase their freedom and control over their own lives, not create dependence on the therapist. Promoting independence is a key part of respecting autonomy. Question 57. Pairing a neutral stimulus with an unconditioned stimulus so that the neutral stimulus eventually elicits the same response as the unconditioned stimulus is the process of A. Operant conditioning. B. Classical conditioning. C. Extinction. D. Shaping. Answer: B. Classical conditioning. This question describes classical conditioning, also known as Pavlovian conditioning. It's a type of learning where a neutral stimulus, something that doesn't initially cause a specific response, gets paired repeatedly with an unconditioned stimulus, something that naturally causes a response, like food causing salivation. After enough pairings, the neutral stimulus becomes a conditioned stimulus, CS, and can then elicit the same or a similar response, now called a conditioned response, CR, even without the original unconditioned stimulus. Pavlov's dog's learning to salivate at the sound of a bell is the classic example. The bell, neutral/CS, was paired with food, UCS, and eventually the bell alone caused salivation, CR. This is about learning associations between stimuli. Question 58. What does the prompt hierarchy refer to? A. The order of steps in a behavior chain. B. The different types of reinforcers arranged by preference. C. A system for arranging prompts from most intrusive to least intrusive, or vice versa. D. The levels of challenging behavior severity. Answer: C. A system for arranging prompts from most intrusive to least intrusive, or vice versa. This question is about the prompt hierarchy, which is a structured way of using prompts when teaching. Prompts can range from very hands-on, like full physical guidance, to very subtle, like a slight gesture. A prompt hierarchy arranges these prompts typically from the most intrusive, most help, to the least intrusive, least help. When teaching, we often start with a level of prompt that ensures success and then systematically move down the hierarchy, fade prompts, to less intrusive levels, aiming for independence. For example, a common hierarchy might go from full physical to partial physical to model to gestural to verbal to independent. Question 59. A cumulative record graph is primarily used to show A. The percentage of intervals a behavior occurred. B. The total count of a behavior over time. C. The duration of each instance of a behavior. D. The time between behaviors. Answer: B. The total count of a behavior over time. This question asks about a cumulative record graph, which is a less common but useful type of graph in ABA. On a cumulative record, the total number of responses recorded adds up over time. The line on the graph never goes down because it's showing the running total. The steeper the slope of the line, the higher the rate of the behavior. If the line is flat, the behavior is not occurring. It gives a visual representation of the overall progress or lack thereof in terms of total responses. It's good for showing things like total words spoken or total tasks completed over many sessions. Question 60. Which consequence involves adding a stimulus following a behavior, resulting in a decrease in the future frequency of that behavior? A. Positive punishment. B. Negative punishment. C. Positive reinforcement. D. Negative reinforcement. Answer: A. Positive punishment. This question defines positive punishment. Remember that positive means adding something and punishment means the behavior decreases. So, positive punishment occurs when a stimulus is added immediately after a behavior, and this addition makes the behavior less likely to happen in the future. An example is a child touching a hot stove, behavior, and feeling pain, stimulus added. If this makes the child less likely to touch the stove again, it's positive punishment. The pain is added, and the behavior decreases. Question 61. The process by which a conditioned stimulus, CS, is presented repeatedly without the unconditioned stimulus, UCS, resulting in the conditioned response, CR, weakening and eventually disappearing, is called A. Operant extinction. B. Classical extinction. C. Spontaneous recovery. D. Stimulus generalization. Answer: B. Classical extinction. This question describes extinction, but specifically within the framework of classical conditioning. Remember, classical conditioning is about learned associations between stimuli. Classical extinction happens when the conditioned stimulus, the thing that learned to trigger a response, like the bell in Pavlov's experiment, is repeatedly presented without the unconditioned stimulus, the natural trigger, like the food. When the bell is rung many times but no food appears, the dog eventually stops salivating to the bell alone. The learned association is broken, and the conditioned response, salivation to the bell, disappears. Question 62. When teaching a client to greet someone by saying hi, you stand behind them and physically guide them to wave their hand while you say hi. This is an example of what type of prompt? A. Verbal prompt. B. Model prompt. C. Physical prompt. D. Gestural prompt. Answer: C. Physical prompt. This question asks you to identify the type of prompt being used when you physically touch or guide a person to help them perform a behavior. That is a physical prompt. In this example, standing behind and guiding the hand is a clear physical intervention to help the client wave. Other prompts involve showing, model, telling, verbal, or pointing, gestural, but physical prompts involve direct bodily assistance. Question 63. A schedule of reinforcement where every response is reinforced is called A. Intermittent reinforcement. B. Variable reinforcement. C. Continuous reinforcement. D. Ratio reinforcement. Answer: C. Continuous reinforcement. This question is another look at continuous reinforcement, CRF. As mentioned before, on a CRF schedule, the reinforcement follows every single instance of the target behavior. If the behavior happens, reinforcement is delivered immediately. This is the fastest way to establish a new behavior. Question 64. When a behavior that was previously decreased through extinction suddenly reappears after a period of time without the behavior occurring. This is called A. Extinction burst. B. Spontaneous recovery. C. Stimulus generalization. D. Response differentiation. Answer: B. Spontaneous recovery. This question describes spontaneous recovery, which is a phenomenon that can occur after a behavior has been put on extinction and has decreased or stopped. After a period of time where the behavior doesn't happen and isn't reinforced, the behavior might suddenly reappear again, often at a lower rate than it was before extinction started. It's like the behavior pops back up unexpectedly. If it occurs and you continue to withhold reinforcement, it will usually disappear again quickly. It's a temporary return of the extinguished behavior. Question 65. Which ethical principle requires behavior analysts to be truthful and accurate in their professional work? A. Beneficence. B. Responsibility. C. Integrity. D. Competence. Answer: C. Integrity. This question asks about the ethical principle of integrity. This principle means being honest, truthful, and accurate in all aspects of your professional work. This includes accurate data collection and reporting, honest communication with clients and colleagues, not making false claims about your services, and maintaining professional boundaries. Upholding integrity is essential for building trust and maintaining the reputation of the field. Question 66. The main purpose of a preference assessment is to A. Teach new skills. B. Identify potential reinforcers. C. Decrease challenging behavior. D. Conduct a functional analysis. Answer B. Identify potential reinforcers. This question, similar to question 1, highlights the core purpose of a preference assessment. While not everything a client prefers will function as a reinforcer, something that actually increases behavior when delivered after it. A preference assessment is the crucial first step in finding potential reinforcers. By determining what items, activities, or social interactions a client likes, we have a starting point for selecting things to use as motivation in teaching procedures and behavior intervention plans. It's about creating a list of MABEs that we can then test to see if they actually increase behavior, become reinforcers. Question 67. A behavior that is taught to replace a challenging behavior and serves the same function is called A. Target behavior. B. Replacement behavior. C. Extinction behavior. D. Discriminative stimulus. Answer B. Replacement behavior. This question is about replacement behaviors, a key component of behavior intervention plans developed from an FBA. Once you know the function of a challenging behavior, why the person is doing it, the goal is often to teach them a more appropriate behavior that achieves the same outcome. This new appropriate behavior is called a replacement behavior. For example, if a child tantrums to get attention, a replacement behavior might be teaching them to tap your shoulder or say, "Excuse me," to get attention. The replacement behavior serves the same function, getting attention, but is socially acceptable. Teaching effective replacement behaviors is crucial for long-term success. Question 68. Reinforcement that is delivered after a behavior that is incompatible with the target challenging behavior is called A. Differential reinforcement of other behavior. DRO. B. Differential reinforcement of alternative behavior. DRA. C. Differential reinforcement of incompatible behavior. DRI. D. Differential reinforcement of low rates. DRL. Answer C. Differential reinforcement of incompatible behavior. DRI. This question asks about a specific type of differential reinforcement called differential reinforcement of incompatible behavior. DRI. In DRI, you reinforce a behavior that cannot physically happen at the same time as the target challenging behavior. For example, if the target behavior is standing up during circle time and incompatible behavior is sitting in your chair, you would reinforce the client for sitting in their chair, the incompatible behavior, and withhold reinforcement if they stand up. The target behavior, since they can't sit and stand at the exact same time, reinforcing sitting directly competes with standing. Question 69. What is the difference between a primary, unconditioned reinforcer and a secondary, conditioned reinforcer? A. Primary reinforcers increase behavior, while secondary reinforcers decrease behavior. B. Primary reinforcers are learned, while secondary reinforcers are natural. C. Primary reinforcers are natural and unlearned, while secondary reinforcers are learned through pairing. D. Primary reinforcers are delivered immediately, while secondary reinforcers are delayed. Answer C. Primary reinforcers are natural and unlearned, while secondary reinforcers are learned through pairing. This question clarifies the distinction between primary and secondary, or unconditioned and conditioned reinforcers. As we discussed earlier, primary reinforcers, like food or water, are naturally reinforcing because they meet biological needs. Their reinforcing value isn't learned. Secondary or conditioned reinforcers, like praise, money, or tokens, are things that become reinforcing because they have been repeatedly paired with primary reinforcers or other established conditioned reinforcers. They acquire their reinforcing value through learning history. Think of primary as born reinforcing and secondary as made reinforcing. Question 70. When collecting data using momentary time sampling, you record whether the behavior occurs. A. At any point during the interval. B. At the very end of the interval. C. For the entire duration of the interval. D. After a specific amount of time has passed. Answer B. At the very end of the interval. This question describes momentary time sampling, another type of discontinuous measurement. Unlike partial or whole interval recording, in momentary time sampling, you only look to see if the behavior is happening at the specific moment the interval ends. You set a timer for a certain interval length, say 1 minute. When the timer beeps at the end of that minute, you look up and quickly record if the behavior is happening right then. It doesn't matter if it happened earlier in the interval or right after. Only what's happening at that exact moment counts. This is often used for behaviors like on task or in seat. Question 71. When teaching a client to build a tower with blocks, you help them stack the first block, then the second, and so on, teaching the steps in their natural order. This is an example of A. Backward chaining. B. Forward chaining. C. Total task chaining. D. Shaping. Answer B. Forward chaining. This question describes forward chaining, another method for teaching behavior chains. In forward chaining, you teach the steps of the chain in the order they naturally occur, from the first step to the last. You prompt the client through all steps after the first one, and you teach the first step until they can do it independently. Once the first step is mastered, you teach the first 2 steps, prompting through the rest, and continue adding and teaching subsequent steps until the client can perform the entire chain independently. Reinforcement is typically delivered upon completion of the last step. You're moving forward through the steps. Question 72. A procedure where reinforcement is delivered for a low rate of the target behavior is called A. Differential reinforcement of other behavior. DRO. B. Differential reinforcement of alternative behavior. DRA. C. Differential reinforcement of incompatible behavior. DRI. D. Differential reinforcement of low rates. DRL. Answer D. Differential reinforcement of low rates. DRL. This question describes differential reinforcement of low rates. DRL. DRL is used when you want to decrease a behavior, but you don't want to eliminate it completely. You just want it to happen less often. Reinforcement is delivered if the behavior occurs at a rate lower than a specified level, or if a certain amount of time has passed since the last instance of the behavior. For example, if a student asks questions too frequently, but you don't want them to stop asking altogether, you might reinforce them if they ask no more than 3 questions in an hour, interval DRL, or if a certain amount of time passes between their questions, IRT DRL. You're reinforcing a lower frequency. Question 73. What is the primary purpose of conducting an FBA before developing a BAP? A. To confirm a diagnosis. B. To determine the cost of intervention services. C. To ensure the intervention addresses the function of the behavior. D. To get parental consent. Answer C. To ensure the intervention addresses the function of the behavior. This question reinforces the crucial link between the FBA and the BAP. The whole point of doing an FBA is to understand why a challenging behavior is happening, its function. Without knowing the function example attention, escape, tangibles, sensory, any intervention developed is just a guess and is unlikely to be effective in the long run. An intervention is most likely to succeed when it directly addresses or replaces the function the behavior serves for the individual. The FBA provides the roadmap for building a functional, effective BAP. Question 74. When you reinforce a behavior every fifth time it occurs, you are using which schedule of reinforcement? A. Fixed ratio, FR. B. Variable ratio, VR. C. Fixed interval, FI. D. Variable interval, VI. Answer: A. Fixed ratio, FR. This question describes a fixed ratio, FR, schedule of reinforcement. In an FR schedule, reinforcement is delivered after a fixed, unchanging number of responses have occurred. The number of responses required is always the same. Reinforcing every fifth response means the ratio is fixed at 5. 5 responses to 1 reinforcement, or FR5. FR schedules typically produce high rates of responding with a pause immediately after reinforcement. For example, getting paid $1 for every 10 envelopes stuffed is an FR10 schedule. Question 75. According to the BCBA ethical code, when a potential conflict of interest arises, a behavior analyst should: A. Ignore the conflict if it benefits the client. B. Prioritize their own interests. C. Disclose the conflict and seek to resolve it in favor of the client's best interests. D. Transfer the client immediately without discussion. Answer: C. Disclose the conflict and seek to resolve it in favor of the client's best interests. This question addresses the ethical handling of conflicts of interest. A conflict of interest is when a behavior analyst's personal or professional interests might interfere with their ability to act solely in the client's best interest. If a potential conflict arises, the ethical requirement is not to ignore it, but to be transparent about it, disclose to all relevant parties, and actively work to resolve it. The resolution should always prioritize the client's welfare and needs above the analyst's own interests. Openness and prioritizing the client are key here.